Hi, I'm Dr. Olmos, and I'd like to welcome you to our weekly video series, Ask Dr. Olmos. Today's question is, can TMJ cause balance issues? And the answer is yes, but there's a bit of background with this person, Maureen, who has this question. And she says that she's had balance TMJ issues since she was a kid. A few years back, 2017, she had a lot of dental work that caused a flare-up, and she went to a number of ear, nose, and throat doctors, thinking that because she had this problem with her ear, and they looked at her ear and they couldn't find anything. She's hearing noises, popping noises in her jaw, and she feels like she's floating, so she has not good equilibrium, and she has dizziness and headaches at the back of her head, and so she's wondering if a jaw problem can cause balance issues. And absolutely, everything that you just described is a symptom of a TMJ issue. So there's various mechanisms. So we'll start with the postural one that you asked. So when the jaw is inflamed from overuse, especially at nighttime, then the person wakes with inflammation in their jaw. And so when they go to swallow, you go ahead and swallow, you feel like your teeth come together, and that's the furthest the lower jaw goes into the skull, and it pokes the inflammation. And that's uncomfortable because a person swallows up to 2,500 times a day, so that's a lot of poking. And as a result, you tend to lean forward so your jaw hangs away from your skull. And this forward head posture kind of rotates your body and causes neck pain and low back pain. I published a study many years ago that when we use devices to decompress the jaw in the daytime, we were able to upright people about 4.5 inches. So for every inch your head's forward of your shoulder, it adds 10 pounds of weight to your neck and your back. So in that study, we showed from all ages, 13 to I think it was 72 or 73 were included in that study, and all of them improved the head position. On average, it was 4.3 inches, so almost 4.5 inches of uprighting, 45 pounds of weight off the necks and backs. So posturally, absolutely. In relation to your ear-related symptoms, so when the swelling in the jaw joint, there's a fissure that connects the jaw joint to your middle ear, where your ear canal is, and that fluid from the swelling goes into the middle ear and confuses your equilibrium apparatus, your cochlear ducts there with the cilia, and so there's too much fluid, and so it gives you that dizzy feeling. So a lot of the reasons why you're having these issues is still your jaw problem, which you've had your whole life and clearly hasn't been addressed. There are component parts to what might be causing that. What we found in a study that 1,400 patients that should be published May or June of this year, because we've been accepted for publication for this paper. And we found that nasal valve compromise, the first point of entry of air into your nose can cause, is 7 times more likely to present with facial pain. So nasal obstruction can cause jaw joint relationships. Breathing disorders, your throat, apnea, things like this can cause jaw related problems. So you need to be investigated. You need to be examined for all of these parameters to get complete resolution of all the different things that you're asking about, but they certainly can be addressed. Make sure you subscribe to our channel and submit your questions for next week's video.